Hello students, welcome to DBMCI MDS Experts, and the first topic that we are going to see is General Epidemiology. I am your PhD faculty, Dr. Shilpa. So let us look into the contents of General Epidemiology first. So you will have a short introduction. We'll look into few definitions. We'll look into aims of epidemiology. We'll see the tools of measurement in epidemiology. And in the next part of the few sessions, we'll see the epidemiological study designs. That is, we'll look into descriptive epidemiology, analytic epidemiology, experimental epidemiology. So, to look into what is the etymology of the word epidemiology, the word epidemiology derives from the Greek word epi means upon, demos means people, and logos means study of science, study or science. So essentially epidemiology as defined by John M. Last, epidemiology is the study of the distribution and determinants. Epidemiology is the study of the distribution and determinants of health-related states or events in specific population and the application of this study to control health problems. So as you can see, there are two important words here, distribution and determinants in the definition of epidemiology. So briefly look into the contribution by the father of epidemiology, John Snow. So what happened is that John Snow, who is called as the father of epidemiology, he developed an interest in the outbreaks that were happening in the area of London called as Soho neighborhood of London. So when he traced the source of this 1854 cholera outbreak, he got to know that statistical analysis revealed that it was the source of drinking water was the cause of this cholera outbreak. And the report was published in 855, and this was considered as a first ever epidemiological study. And that's why he is rightly called as the father of epidemiology. And cholera is called as the father of public health. So now we come to the aims of epidemiology. So the first aim is to describe the size and distribution of the disease problems. In human populations. So the first aim is to describe the size and distribution of the disease in human population. The second aim is to provide the data essential for the planning, implementation, and evaluation of health services. The second aim is to provide the data essential for the planning, implementation, and evaluation of the health services. And the third aim is to identify etiological factors. In the pathogenesis of disease. So these are the aims. That is, to describe the size and distribution of the disease problems, to provide the data essential for the planning, implementation, and evaluation of health services. And the third aim is to identify the etiological factors in the pathogenesis of the disease. So with this, we can plan how to control the disease or prevent the disease. Now we come to principles of epidemiology. What are the principles of epidemiology? There are 4 principles in epidemiology. The first principle is exact observation. Exact observation. So the observation should be exact observation, means it should be strict and precise observation, vigorous, accurate, precise observation. The second principle is correct interpretation. Correct interpretation. So that means it should be free from error. Correct interpretation. The epidemiological study method should be free from error. The third principle is rational explanation. Rational explanation. So that means the explanation should be intelligent and reasonable. Intelligent and reasonable. And the fourth principle is scientific construction. Scientific construction means it should be by expert knowledge and skill. By expert knowledge and skill. So these are the principles of epidemiology: exact observation, correct interpretation, rational explanation, and scientific construction. Now we come to the tools of epidemiology. Tools of epidemiology. So you have rate, ratio, and proportion, which are the tools of epidemiology. We look into each in detail. So what is rate? A rate is the frequency of disease or characteristic. Rate is the frequency of a disease or characteristic expressed per unit size of the population. Frequency of disease or characteristic expressed per unit size of the population. So what is the formula for rate? The formula for rate is that it is the number of events in bracket deaths or disease that we are looking into. The number of events or deaths or disease in a specified time period divided by the population at risk into 10 raised to n. So as you can see, there is a numerator here, that is the number of events or deaths, the population at risk, it could be deaths or disease, and the population at risk, which is the denominator, and you have a multiplier. So this is always there in the formula for a rate. So for example, let us take an example. In a group of school children, so here in a group of school children, n equal to 5,000. When you examine, you found the dental caries to be 2,000, right? So what is prevalence rate? Equal to 2,000 by 5,000 into 1,000 equal to 400 by 1,000 equal to, so it is 400 per 1,000 children. Now we come to the different categories of rates. Different categories of rates. So you have crude rates. Crude rates are the actual observed rates. Crude rates are the actual observed rates. The example can be birth rates or death rates. So they are crude rates. The next are the specific rates. Specific rates are the actual observed rates due to specific causes or specific diseases occurring in a specific group. They are specific rates due to specific causes or diseases occurring in specific groups in specific time periods. These are specific rates. Then you have standardized rates. Standardized rates are obtained by direct or indirect standardization. Standardized rates are obtained by direct or indirect standardization. So, example is adjustment like age adjustment or sex standardized rates. These are standardized rates. So now what are the common example for rates, students? They can be birth rate, death rate, fertility rate, etc. Now we come to next, that is the next tool of epidemiology, that is ratio. The next tool of epidemiology, that is ratio. So ratio denotes the relationship in size. Ratio denotes the relationship in size between two random quantities. Between two random quantities. Ratio denotes the relationship in size between two random quantities. In ratio, the numerator is not a part of the denominator. The numerator is not a part of the denominator. Please note. In ratio, numerator is not the part of the denominator. Example, you may have incidence of gingivitis in pregnant women versus incidence of gingivitis in non-pregnant women. So, for example, if you have incidence of gingivitis in pregnant women as 20 by 1000 and if you have incidence of gingivitis in non-pregnant women as suppose 10 by 1000, then the ratio will be 2:1. So, please note, you can also give examples of dentist population ratio. Anything A is to B where numerator is not part of the denominator, that is a ratio. So, now we come to proportion. In proportion, numerator is part of the denominator. Numerator is part of the denominator. So that is proportion. It is the expressed as the relationship in size. Proportion is expressed as the relationship in size or magnitude as part of the whole. As part of the whole. So, in proportion, numerator is always part of the denominator. In proportion, numerator is always part of the denominator. So, for example, if you have an example for suppose the number of school children. The number of school children with dental caries in a specific time period by the total number of students examined. The total number of school children examined into 100. So this is example for a proportion. Whereas in ratio we saw, for example, if it is school children with dental caries, school children with dental caries, whereas school children with dental fluorosis. So numerator is not part of denominator, that is ratio. Whereas when you see school children with dental caries by total number of school children examined into 100, then it is a proportion. So those were the tools of measurement in epidemiology. Now we come to basic measurements in epidemiology. Basic measurements in epidemiology. So what are the basic measurements in epidemiology. So, the most commonly used measurements are measurements of morbidity and measurements of mortality. Measurements of morbidity and measurements of mortality. So, what is mortality? Mortality is a condition of being mortal or susceptible to death. Mortality, that is the condition of being mortal or susceptible to death. So, what are the various measures of mortality? So, either you can have a crude death rate, then you can have a specific death rate, crude death rate, specific death rate. These are all measurements of mortality. What is crude death rate? Number of deaths during a year in a population, number of deaths during the year in a population by the mid-year population, into 1000. So that is crude death rate. What is specific death rate? Specific death rate measures the number of deaths among people per thousand, per thousand in that category. So that is a specific death rate. For example, specific death rate due to oral cancer. Specific death rate due to oral cancer. Specific death rate due to oral cancer equal to number of deaths due to oral cancer in the year, number of deaths from oral cancer during a year by the mid-year population, into 1000. So that is specific death rate due to the specific disease. Then you have age specific death rate. What is age specific death rate? This is also a type of mortality rate. Age specific death rate. Age specific death rate is the death rate specific to given age group. So it is, for example, number of deaths in persons aged a certain age group. For example, you can take 45 to 65 years in a given year by the mid-year population of the persons in that age group, by the mid-year population of persons aged 45 to 65 years into 1000. So this is a age specific death rate. This is age specific death rate. Now you have case fatality rate. Case fatality rate is also a mortality rate. What is a case fatality rate? So, if you have total number of deaths due to a specific disease, total number of deaths due to a specific disease divided by the total number of cases due to the same disease, the total cases of that disease into 100, that is a case fatality rate. The total number of deaths due to a specific disease by total number of cases due to the same disease into 100 is case fatality rate. Now we come to proportional mortality rate. Proportional mortality rate. It is also another mortality rate. So it is total deaths due to a particular cause, total deaths due to a particular cause, total deaths due to a particular cause per 100 or 1000 total deaths, per 100 or 1000 total deaths. That is proportional mortality rate. So these are used when the data is not available. When the data is not available. Now we come to standardized rates. Standardized rates are defined as the overall rates adjusted for the effects of differences in population, overall rates adjusted for the effects of difference in population composition. Example, age and sex, differences in age, gender, etc. So this is done cases where we want to compare the death rates. So this is done in cases where we want to compare the death rates, of two populations. In cases we want to compare the death rates of two populations with different age composition. So this can be done by direct or indirect standardization, which I have already mentioned. By direct or indirect standardization. Then the last mortality rate that we have to see is the infant mortality rate. The infant mortality rate. Please note, these rates are very important indicators in the understanding the development of a country. So the number of deaths among infants, under 1 year of age, per thousand live births, is the infant mortality rate. Now we come to what are the factors affecting mortality rate. So there could be various factors that are affecting the mortality rates. What are they? So it could be a high birth rate, which often is associated with the high infant mortality rate or a maternal mortality rate. So one factor could be a birth rate. Then the density of the population could be affected. When high population density is there, it generally indicates an increased environment where there is a large increased risk of infection. So it could be density of the population. Then geographical location is another factor, where if the geographical location is a very good area, undisturbed and quiet area, then it could be the lowest mortality rates that you are seeing. Then it could be the season. For example, if there is a winter and there is cold, so then in those cases it could influence the mortality. Epidemic experience. So we saw the other factor recently, for example, the COVID pandemic. For any disease, when it becomes a public health problem, it will affect if it becomes a serious problem, it will affect the mortality. So epidemic. And then other factors are secular variations. Secular variations are the next factor that influence mortality, that is incidence of some diseases and mortality. Incidence of some diseases and mortality varies with time. So it could be due to factors including some alteration in diagnostic criteria or better treatment methods. So it can vary with time. The situation can vary with time. Now we come to the measurements of morbidity. So what we saw were the measurements of mortality. We saw crude death rate. We saw specific death rate. Crude death rate is the number of deaths in a year in a population by media population into 1,000. Specific death rates due to oral cancer, for example, it is number of deaths from oral cancer by media population into 1,000. We saw age specific death rates, which is, for example, specific to a certain age. Then we saw case fatality rate. we saw proportional mortality rate, and we saw standardized rates, we saw infant mortality rate. Then we saw the factors affecting the mortality rate. It could be birth rate, density of the population, the geographical variations, the secular trends, meaning the changes in time could have an effect on the changes in the mortality in a specific region, seasonal variations, density of population, epidemics. These are all the factors affecting mortality rates. Now we come to measurement of morbidity. So, what is morbidity? See, morbidity is any departure, subjective or objective, any departure, subjective or objective, from a state of physiological well-being, that is morbidity. So, according to WHO, morbidity can be measured based on 3 units. So, it can be measured from persons who are ill, the illness or the disease experienced, and the third is the duration of illness or these diseases, So these are the 3 factors by which the morbidity can be measured. What are the uses of the morbidity data? So the uses of morbidity data can be to describe the extent and nature of the disease in the community, and this will help us establishing the priorities. Then morbidity data are useful in providing comprehensive and accurate clinical information. Accuracy. So that is the word here. It helps in providing accurate information, which are clinically relevant information on the patient characteristics. Then the importance of morbidity data is they serve as a starting point in etiological studies. So when you want to do a study to know the etiology, so it serves as a starting point in etiological studies and thus play a crucial role in disease prevention. Then the fourth use of morbidity data is they are needed for the monitoring and evaluating disease control activities. For the monitoring and evaluation of disease control activities. So these are the uses of the morbidity data. So in the next sessions, we will see what is incidence, what is prevalence, and we will also see various study designs, etc.